Hello class, my name is Michelle and the case study I did is case 6.1, page 357. Is it ethical to criticize other dentist work? First off, I'm not a great public speaker, so by no means don't judge this. The reason why I chose this case study was because I'm a dental hygienist and I've been in the dental field for 6 years. So it kind of was fun to do something on my own personal level that I know a lot of information about. So a little back history on this case study. It basically says that a patient comes into the dentist office complaining of open contacts, food impaction, sensitivity with their teeth around composite restorations. Those of you that aren't in the dental field, that probably makes no sense. So I'll kind of break it down. Basically, when you get a cavity in your tooth, we drill the cavity out and then we put a tooth colored material in it, bond it in the tooth, and that's what we call a filling or a composite restoration that they're talking about. Whenever they're between two teeth, that means interproximal. So here's tooth number 1, tooth number 2, where they meet, this space right here in between the teeth, that's what they're saying is an open contact. So instead of being tight and snug, there's a space like this, so food's getting stuck in there, causing the food impaction. When people floss, you're supposed to get a good snap. These patients are complaining they're not getting a good snap, or their floss is getting hung, because in an ideal world, whenever you floss your teeth, you get a nice little snap in, snap out. Floss doesn't shred. It's in pretty good condition. These patients are saying, you know, they're complaining of things. Basically, they're saying the dentist that they went to did not do the best work, and it's saying, is it ethical for us to criticize the other dentist work? I can answer this right away. It is not. It is not professional to do that. You never talk bad about another dentist or a dental professional work in the dentist profession. First off, it is so small that you can get a bad reputation fast if you talk bad about other dentists. In the book, it says the American Dental Association's Principles of Ethics and Codes of Professional Conduct addresses this issue. Basically, it says a bunch of information, but breaking it down, it means you need to acknowledge the patient, acknowledge their health, be honest with them about it, but you do not make any disparaging comments about prior services that they've received. It says right here on page 358, our reader acknowledges awareness of the need to honor his or her patient's autonomy by accurately informing the patients of their present oral health status without making disparaging comments about prior services. It also says when a dentist makes a statement to a patient regarding the efficiency and quality of treatment rendered by a previous dentist, it's important to keep in mind that the patient has no obligation to treat the statement or opinion as confidential. Basically, what this is saying is if you say, hey, Sally, Dr. John Doe did a terrible job on your fillings, there's a 99% chance that they're going to go tell that dentist, and then that dentist is going to come back very upset with you. So you don't make comments that you don't want the public to be informed about. It also says on here, as clinical dentists, our first obligation is to place the well-being of the patients ahead of our own interest with certain limits. Basically, you be honest with the patients. You say, you know, like, hey, Sally, I do see that we have an open contact, but I'll tell you what, we can fix that with another filling, and this is how we go about doing that. Patients are always so pushy, like, well, did the other dentist do a bad job? Did they do this? Did they do that? Well, Sally, you know, we're not them. We don't know their protocol. We don't know how they do things. You just really stay biased on it. You can tell them things like, you know, sometimes teeth do move around, sometimes fillings do break around, and it may not have been the dentist's fault at all, but it's not professional to blame the other dentist. The questions in the back of the book think about the concept of professional loyalty. Although patients are top priority, can disparaging comments about another dentist's work provide the care for which the code calls? You know, basically you are putting the patient's interest first. You're stating that there's a problem, you're stating that you can fix the problem, but you don't need to bash another dentist because that's not professional. It's a good way to get a bad name about yourself, and you know, you can't trust it. Like, it's not professional. You wouldn't want someone talking about you, so it's kind of like the golden rule, do as to others as you want them to do to you. So that's kind of answers that. Do what's best for the patient, state that there is an issue, state how you can fix it, and that you're willing to fix it. Very biased on if they did a good job, if they did a bad job. Kind of stay away from that the best you can. The second question, what are some of the roadblocks you can determine by thinking about justifiable criticism? How can a dentist be sure a patient's interpretation of his or her diagnosis? My office is awesome at this. We take digital x-rays as well as intraoral x-rays. So basically, like this video of you, we show patients things like this. We're like, okay, this is what your tooth looks like. This is what it should look like. We have videos to show, like, this is our process. This is how we do things. We make it pretty simple for them to understand. So that's the best quality of care we can give our patients, is just ensure that they understand what we're talking about, that we're giving them the best quality of care, and we will do it to our best, best possible way we can. But the one thing you do not do is you do not criticize another dentist's work. Not saying in my field that I haven't seen dentists work that haven't done a great job, and patients are like, well, why is it like this? Why was it done like this? Well, you simply say, I'm not them. I don't know their protocol. I don't know the procedures. I don't know enough about your home care prior to this point, but this is what we do know moving forward, that there is a problem. This is how we're going to correct it. And, you're in good hands. Like I said, visual aids are huge. If you show them videos, pictures, talk to them, show them, that really helps out a lot. But as the book states, the American Dental Association is kind of like the Bible that us dentist professionals abide by. And, they're saying you're obligated to tell the patients, what's going on, but be as vague as possible and do not bash another dentist. It does touch in here a little bit stating about, if you are seeing very poor quality work done by a dentist, it is kind of your ethical job to report them. So if you're seeing something that's not done properly, it's becoming a huge issue, you're seeing it over and over again, you can kind of use your own personal judgment and you can report that if needed. And then once again, you've done all you can. That's American Dental Association. They're kind of like the police that we abide by, and they would deal with whatever happens to that specific dental professional. They would open up a case most likely, and they would do what they can. But moral of the story, give your patients the best quality of care you can, but never ever bash another dental professional in front of the patient, or else it can make you look very unprofessional. Thank you.